HPV infection can stay in the cervix and the genital area for approximately 18 to 24 months in total. The easiest way to get HPV is through unprotected sexual intercourse, also through intimate kissing as well. So those are the two main mechanisms through which HPV is transmitted. Today, I'd like to speak to you about a subject that is extremely close to my heart, HPV, more commonly known as human papillomavirus. So, what is HPV? Well, as the name suggests, it is a viral infection, just like COVID, or in fact, the flu virus. And like the flu virus, or indeed COVID, there are vaccines against HPV. But let's just dig into HPV a little bit more first. So how do you actually contract HPV? Well, the easiest way to get HPV is through unprotected sexual intercourse, also through intimate kissing as well. So those are the two main mechanisms through which HPV is transmitted. Now, unlike flu or indeed acute COVID, HPV infection can stay in the cervix and the genital area for approximately 18 to 24 months in total. And like most viruses, there's no direct antibiotic that we can give to clear it. So we're very reliant on the body's immune system clearing it naturally over time. So how do we actually find out whether we've got HPV or not? Well, traditionally, the most common time that we find out we've got HPV infection is during a smear test, because HPV virus infection can affect the cells on the cervix, and that is something that we find out and explore when we're having a smear test. Now, there are lots of different strands of HPV, so some of the strands may present with changes on the external skin around the vagina, the vulva, so you may notice a warty appearance. And indeed, one of the questions you might be asking is, that's very helpful to know, Dr. Shree, but can we actually prevent infection with HPV? And there are actually vaccines available, typically given in our early teens, to prevent some of the most common strands of HPV, but you cannot prevent all of them, which is why making sure that you go for your smear test or consult a doctor if you've got abnormal vaginal discharge, itching, or you've noticed skin changes down in the vaginal area is incredibly important. We'll always make sure that we find out more about you in terms of your medical background to see if there are any risk factors before examining and potentially considering an infection screen as well as a smear test. Now, once you've actually contracted HPV, what can we actually do about it? Well, I said earlier that there's no obvious cure, but with time, your body can clear it. So the easiest way to make sure that your body is in optimal condition to clear HPV is to have a healthy, balanced lifestyle, making sure that you have a healthy, happy routine where you're going to bed on time, you're eating regularly, you're upping the antioxidants in your diet can be incredibly important, particularly if you're someone who's prone to colds, can mean that it takes a little bit longer to shake off HPV. Now, you may also say, well, why does it matter if I've got HPV? Well, earlier I mentioned the importance of smear tests, and HPV is one of the most common factors that can cause cell changes on your cervix. And if that's the case, that will be picked up in a smear, and you'll be referred to our specialist colposcopy clinics where we'll examine the cervix further. So what can we do if we have HPV? Well, we watch and we wait. As I said earlier, we may need to repeat those smear tests and refer you to colposcopy, where we have a closer look at the cervix. But increasingly, there are products in the market where we can apply vaginal gels potentially, which may help accelerate that clearance. Now, these are in very early stages, but certainly these are the types of things that we will discuss with you when we see you, if it's appropriate for you to consider those types of treatment. So, in a nutshell, today we've looked at what HPV is, how we can get HPV, whether in fact we can prevent it, and what to do about it. We've also looked at why it's so important, once it's been diagnosed, to monitor it and how we can think about potential treatments in the longer term. So I hope that's been helpful, and do get in touch if you have any further questions.